Hello everyone, Dr. Suguna here. Now we're going to learn the anatomy of the basal ganglia. So the basal ganglia are structures that are present in the brain concerned mainly with movement and reward. So this region is concerned with movement and reward. So basically, basal ganglia is a misnomer because the cerebrum cannot have ganglia in it. That is why we are calling it a misnomer. So this part is a constituent part of the telencephalon of the brain. So it constitutes a few nuclei that we will have to understand and memorize. It is a collection of nuclei and not ganglia. That is why it is a misnomer. So the nuclei are of two types, the structural nuclei and the functional nuclei. The structural nuclei are the nuclei that are present in the telencephalon, that is in the cerebral hemispheres over here, and the functional nuclei are present in the diencephalon and mesencephalon and have a functional relation. Okay, so the structural nuclei are present in the telencephalon, whereas the functional nuclei are present in the diencephalon and mesencephalon. Now, the basal ganglia, we have spoken, there are so many types of nuclei. Let's learn about these. The structural nuclei include the caudate nucleus, the putamen, globus pallidus, and the amygdaloid nucleus. Now, we all are familiar with all of these names. So, I will quickly revise these names. The structural nuclei include caudate, putamen, globus pallidus, and the amygdaloid nucleus. And the functional nuclei include the subthalamic nucleus that is present in the diencephalon and the substantia nigra that is present in the mesencephalon. So, the functional nuclei both start with an S. The subthalamic nucleus and the substantia nigra both are functional. Structural nuclei do not start with S, though it is structural. Caudate, putamen, globus pallidus, and the amygdaloid nucleus. All right. Now, when we look at the internal capsule, we know that it has two limbs, the anterior limb and the posterior limb. So the anterior limb, as you can note, it is sandwiched between the lentiform nucleus laterally. So this is the lentiform nucleus over here, right? And medially there is this caudate nucleus. Okay, this is the caudate and this is the lentiform. And the posterior limb, this is the posterior limb of the internal capsule, and it is sandwiched again between lentiform nucleus laterally, and this region is our thalamus. Okay, so the both anterior and posterior limbs have lateral relation to the lentiform nucleus, and anterior limb is located medially to the caudate nucleus, whereas posterior limb is related to the thalamus. Okay, now what are the functions? They are mainly concerned with planning and programming of voluntary motor activity. Okay, that is basically related to the extrapyramidal symptom. So voluntary motor activity is done by pyramidal system, but the planning and programming is done by the extrapyramidal system. Motor activity is done by the pyramidal system, whereas planning and programming is done by the extrapyramidal system. So the extrapyramidal symptoms occur when the extrapyramidal tracts are damaged. What are these symptoms? These are tremors, that is purposeless or involuntary movements, then chorea, then athetosis and balismus and hemibalismus seen in the lesion of subthalamic nucleus. Now these are all related to the functions of the basal ganglia. When there is a let's say an ischemia or a bleed which causes a disorder of the basal ganglia, mainly when the subthalamic nucleus, that is a functional nucleus, is involved, we have what is known as the hemibalismus. Okay, they present with, that is the basal ganglia pathologies present with extrapyramidal symptoms because they are concerned with the planning and programming of voluntary motor activity. So what are these extrapyramidal symptoms? These include tremors, chorea, athetosis, balismus, and hemibalismus. What is this hemibalismus? It is purposeless involuntary movements. And another important lesion is the Wilson's disease. It is seen in the lesion of the lentiform nucleus. Okay, you just have to remember the name. The lesion of the lentiform nucleus presents as Wilson's disease. Okay, again, that is also constituted by purposeless involuntary movements. Okay, then we are looking at substantia nigra. It is dark colored due to the presence of melanin. They produce dopamine, for the nigrostriatal pathway. The neurotransmitter that is produced is the dopamine. Okay. Then we have the Parkinson's disease. We know that it is characterized by reduced dopamine levels, and the nigrostriatal pathway is compromised in Parkinson's disease. So the characteristic features we are very familiar with. These are the pill rolling tremor, the cogwheel or the lead by rigidity, and of course your hypokinesia. The treatment, yes, we go for levodopa and trihexyphenidyl, which acts as an anticholinergic drug. So, the other clinical features of Parkinson's disease include mask-like facial expressions, slow and shuffling gait due to difficulty in starting and stopping movement. So, the person walks slow and shuffling gait, right? Then there's a pill rolling tremor, something like this. The tremor is like this. Then there is cogwheel rigidity and lead pipe rigidity. So, these are the important points about basal ganglia. Thank you.